The shadow came on us, took over our lives. But somehow now's the time we must unite.
Be bold, be brave, be still. In the end we shall heal. 'Cause there's an answer, and together we will stand and fight. Lagi lojing dong ka klam kitap lagi. Ya kan syarat jingger menyingkir mantasi.
Nhìn ya kết kỳ jing ya le but kỳ jing he. Ha jing du ai nhìn sa boy sha ka thong ka bangi be.
We'll gather at the darkest hour, in this battle with faith and power. Long as we don't lose track of sight, together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long. Tatung ai bu ching che the gen sal sao an ching am tel get ta kru kan ku ai no dingi perse खुशियाँ ना होगी कोई पाबंदी मिलके रहना है हमको जैसे हो कोई family.
Okay, be bold and be brave and be strong and fight on, live on. It's not the end, it's a bend in the road. Let's move ahead, no stopping yet. Let's move ahead, let's not forget. Faith alone dries every tear, and when all hope seems lost, let's bow down in prayer. No matter who you believe in, there's no denying a blessing. Heal and recover, let's stand here, united as one.
We will gather at the darkest hour, in this battle with faith and power. Long as we don't lose track of sight, together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long.
Issued in public interest by National Health Mission Government of Meghalaya.
Good evening, friends. Good evening to the people behind the camera who have helped set this up. Good evening to all of you viewers at home. I hope we are able to help you with all your questions and with explaining to you what this disease is about and why it is important for us to recognize and treat it, and how should we recognize and treat it. So we have a very, very good panel with us, and the panel itself will give us an idea about what are the corners and the pillars of the control of this disease. So the first one, our most esteemed guest, is Dr. Matthews. He is a very, very good clinician with great clinical acumen and has fought tirelessly against COVID at St. Stephen's, and I know that he has saved a lot of people who I personally know too. Thank you, Dr. Matthew, for your fight against this disease and for coming online actually today to give us your valuable experience, because I know you more than anybody has a very thorough understanding of the disease. And you know, if we could get an insight into your brain and to tell us like the few key pointers about what are the things that are important. When do we have to worry? What do we have to watch out for? What are the tests that we need to do? So he is the person who is going to be taking us through the clinical part. And then we have with us Dr. Robert Marak, who is the District Surveillance Officer or IDSP East Khasi Hill. He will tell you that testing is the very first step in this fight. We test because that is what is going to give us control. Control depends on you. You are the person. COVID. Once you know that you have COVID, you isolate yourself. Once you isolate yourself, you tell people around you that, okay, I have met you in the last 5 days and I have COVID. Please go out and get yourself tested. And then in those people whom you've met, it's your responsibility as the person who has become positive to tell the people whom you've met in the last few days that they need to remain quarantined. When they're in quarantine, they have to look out for symptoms. His symptoms ki bari phidi even along no, but he bayong clay pisno should bayong clay ba slap lane ba kriat lane But it's okay. You never know. Is it COVID? Is it not COVID? Nobody will know unless you get tested. You won't know. Of course, now in this variant, we have found that a lot of times people don't test positive. So even the symptoms might require you to take treatment. But the first thing you do when you know that you've been in contact with a person who has COVID is you quarantine yourself. Once you quarantine yourself, then if you've tested and you test positive, there are certain numbers which Prakash will flash on the screen for you right now. And these numbers are available for you to reach out to a doctor. Phone ye ki doctor ki bala train ban tek ye ki symptoms ki ba ki don what shu shong ha yeng what le kumbam tibi what ting what re namar lada piting but lada pi re kamut ki bahayeng jong pi ki breu ki pasar dong jong pi ki long at risk. People risk. You are increasing the risk to the people around you by pretending that you don't have the disease. So the buck stops with you. Don't hide your head in the sand. That's not going to help. You have to be proactive. By being proactive, you are doing yourself a favor, you are doing the people around you a favor, and you are doing the world a favor, because by testing, you will know that you have to take treatment. And Dr. Matthews will tell you this, that early treatment, the right treatment at the right time is going to save your life. And thirdly, we have with us Dr. Lyngdoh, who is the person who is taking care of the vaccination in the state, and she will, she will tell you that this is the other prong with which we have to fight this disease. Because if we don't get vaccinated, no matter how much we treat, no matter how well we treat, we will get infected again and again. Kane ka vaccine, ka day, ka ban ya rap ya thi, ba phin yo ya ka tu ka jing ka bor, ba phin ya le persha ya kin ya kane ka virus, namar phin yo ki antibodies ki mi na ka met chong phi. Lada phi yo ya ka disease ro phin yo antibodies, lada phi yo ya ka vaccine ro phin yo antibodies. Tila him kwaban yo pang shim ka vaccine. Ka way ka vaccine ru ka yarap tang ba la ki brew ki ba yo tang way ka vaccine hadin shibnai ki la yo ka tuk nitli ki antibodies. But the full antibody will only come after you have taken both the vaccines. So it's very, very important for you to take both the vaccines and take them at the prescribed time, but do not stand back, do not step away. But then now also more and more in this present variant, we have found, as Dr. Matthew will tell you, that even testing is sometimes not enough. So Dr. Matthew, I hand over to you to take us through. So there was a show in some earlier days where somebody asked the question that how do I differentiate between the common flu and COVID? Yeah, of course, but you can never tell. If you can't test, you can't tell. But the thing is, is testing enough, and what are the symptoms? Dr. Matthew, thank you very much.
Thank you, Carreen, and good evening, and namaskar, and kumno. I wish I could speak Khasi. Apologize, but then it's a pleasure to be back. I've been to Meghalaya 4-5 times, and each time I've enjoyed and carried back fond memories. Coming to this dreaded disease that has now become a pandemic globally, we have in this surge that we are seeing, 1/3 of the cases tend to be negative. So we have to be alert. So the first thing is high index of suspicion that a particular symptom which looks like a common cold is truly a COVID-19. What are the differences? It's almost the same. You have a little body ache, you have tiredness, you feel exhausted, you have a little sore throat, you have a little pain in the throat, you have a little stuffy nose. Quite unlike the common cold, where you have running nose, you don't normally have running nose in this. That's the difference. You don't have running nose, but you have a little stuffy nose. You have an irritation in the throat, but you're not frankly coughing out like you have in a pharyngitis or a sore throat of a common cold that you have. And you have a headache. It's a kind of a deep headache. It's nagging in the first day and then it settles. Normally, you have slight headache, but not this kind of a headache that you have. You may also have associated fever, but the fever is usually very mild, low grade fever, 100, 99, 99.5, 98.8. So very low grade fever that is there. So these are the things that are commonly seen. Unusually, you may also have loose motions in a small number. About 10 to 14% of people are present with loose motions. They will feel that we've not gone out anywhere. Where did we get this bug from? And we have loose motions. Frequent stools are there. A small number may have symptoms of loose motion along with within a day or two coming up with loss of sense of smell. We call it medically anosmia. And also to go along with it, many have ageusia, that is loss of taste. So you don't feel like whatever food you're having is having the normal taste. So this comes in 2-3 days time. So in a patient in today's time, if you have these symptoms of body ache much more than what you expect, tiredness much more than you expect, a lot of people ascribe it to excessive work that they did. But no, if you're having excessive body ache and tiredness, suspect it is COVID. You have sore throat, itchy throat, a little pain in the throat, stuffy nose, no running nose, a headache, and low grade fever. All these are there, and any one of these presenting, you have to watch out what comes first. Sometimes it's the body ache that comes first. But you may remember fever. But remember, is the body ache is the time when you start your countdown. Because noting what was your first symptom is important in this disease because your timeline calculation depends on your first symptom. What was your first symptom? From there, next day you may have sore throat. Next day you may have, a fever and headache all coming together and loss of sense of smell. But all these are there. For first 2 or 3 days, you will have varying combinations of these symptoms, and that makes you suspect this is corona infection, and you go for a test. Most of the time, 2/3 of the time, you may test positive if you have the disease. What do? You put a swab deep into the nose and deep into your throat, send it for testing. It's called RT-PCR. And that will give you overnight the result. If it is positive, don't worry about the CT score that is mentioned there. Not very significant. Don't be alarmed by that. You look at that. Is it positive or negative? Even if you are negative, but you have the symptom which seems to fit in like COVID, watch out for the next 5 days and isolate yourself. It is important. Once you suspect yourself, you have a duty to yourself, to your family members, and to your friends. You have to isolate yourself. You have to separate yourself from the other family members. If you have space available in your home where you can be in one room and somebody delivers you the food and you dispose of the utensils, you dispose of the waste, and you keep masking all the time. In this disease, the most important precaution is this, because now we are reasonably certain it is the aerosol mode of spread. So you get the virus through the air where somebody has breathed out the virus in their breath, they're excreting the virus in their breath, and you breathe in that air with the virus in it. It goes through your nose or through your mouth, occasionally through your eyes, but not so important as your mouth and your nose. And you have to protect that by wearing this mask and not with your nose uncovered like that, like most people do. That's absolutely useless. You have to have complete coverage, well fitting, all snug fitting. You have to tighten it like that nicely, and you have to take it like that and make sure there are no gaps, completely covered. And don't touch this part. If you are the infected person, the inside of the mask is having viruses. If somebody around you is infected, then the outside of the mask is infected. So you do not touch this side or you don't touch the inside of the mask. If you have to take off the mask, only take it off when nobody is around you. Don't take it off in front of somebody. You have to take it from the side, from this side. Once you've done that, immediately you have to sanitize your hands, and not in a frugal way, liberal amount. You put it like that, complete. But most people carry a small bottle, they don't carry a big bottle. So what is best is to wash your hands with soap and water. Actually, soap and water is better than using a sanitizer, which is alcohol. So it's far better, it's cheaper, it's more efficient. Each time you've touched your mask, make sure you wash your hands, because it has been shown by research a normal human being touches his face somewhere or the other 20 times in 1 hour. 20 times in 1 hour. Therefore, if you're sitting, if with your mask you've touched, you will touch your face sometime or the other, and you will take it to yourself. And if you shake hands, if you touch objects, earlier it was greater risk, but now anything that you've touched outside, particularly public spaces, door handles, lift switches, or bolts, or anything that is commonly touched, these places you should immediately sanitize or wash your hands. The first thing that you do coming home is to wash your hand, and if you've been to a hospital, have a bath, change your clothes. That's your protection. So index of suspicion is the most important thing. You have to suspect you have the thing. Now, once you have the virus entering your body, it takes about 4 to 5 days for the virus to cause the illness, which is the first symptom in you. And that first symptom is the result of your body reacting to the foreign invading virus. And that leads to a fight between the virus and the acute antibodies that are developed. And they have an interaction, and you have fever, you have body ache, you have sore throat, because the virus enters through your throat. So sore throat, you have pain in the throat, and you also have headache. All these symptoms are the early phase symptoms. This is the mild part of the disease. After this, 2 or 3 days it lasts, and it goes into a quiet part of the disease. But by 5th or 6th day, in 80%, nothing happens. They are fine and they are absolutely clear. However, they are infective. Their peak infectivity. So I can if I have the first symptom, I have probably already infected my family members, but I may not have. So it's important that I isolate myself from my family members. And if it's the village setting, if people can be outside, it's far better. Children are playing outside, far better people are playing outside, and they come in only if necessary to sleep. Otherwise, staying indoors, you have to be closed door with the rest of the family, but open window so there's enough ventilation. Even fan, if it is there, it is going out, and you are actually not accumulating the virus within the room. That is important. So if you're around in a room for some time and somebody else enters it, the room may have virus particles, that person may be at risk. We don't want to put your family members at risk. So it's important for you to understand that and take precautions. So isolate yourself, quarantine yourself, and protect your family members. First symptom, the moment it appears, you're infective. 2 days before, you're infective. 2 days later, you're infective. Beyond 2 days, which means beyond these 5 days of the first symptom, 2 before, 2 after, and the day, very little chance of your infecting. So the day I'm exposed, I'm not infected, don't worry. It's only 2 days after I'm infected, I'm likely to infect somebody else. 2 or 3 days, usually about 3 days, not before. But they found that in research, after 9 days, most people don't infect others. After 9 days, they do not infect others. But when you test for the virus, it will test as positive. Now, people get alarmed. Oh, 2 weeks also I'm positive. Don't worry. These are not living viruses. They test for the dead viruses also. So the dead virus also shows up on the test and it is reported as positive. So you have to understand this. A small number of people may test positive 4 weeks also, 8 weeks also, sometimes 3 months also down the line. These are not people that are infective, but they test positive. Infectivity is peak in that 5 day period around your first symptom. After that, you're not infective. The virus is overcome by your body antibodies and you're one. 80%, nothing else happens. You're happy. You may take about 2 weeks to become negative, sometimes 3 weeks. And that's the end of the story for 80% of people. Please remember that. It's only in 10 to 20% of people that the disease takes a dangerous turn. So your job is to see if your loved one is having a disease going on to the dangerous turn. And that is why this is important. The timeline calculation. When was your first day? Your symptoms are there, mild symptoms, mild fever. You may take vitamins at this stage. You may take paracetamol if the fever is going beyond 101 or so. You don't have to take fever tablets for 99-degree fever. Simple, fever do not need treatment. 101 or so, you may take a paracetamol. You can take 2 or 3 paracetamols. It is reasonably safe, doesn't cause problem. You may supplement with vitamins. There is no hard evidence that the medicines that are described and prescribed by a lot of people are really beneficial. So if you really look at all the medicines that have been prescribed, antibiotics have been prescribed, azithromycin, doxycycline, ivermectin, um, the chloroquine, all these drugs have been prescribed in varying doses right from the first day of your symptom. But there is no hard evidence to tell you that it makes a difference to the outcome. People have prescribed it, but I would certainly not recommend antibiotics right in the first week. Others, I don't think it makes much difference if you would unnecessarily have side effects from those drugs. But you may
Thank you.
consider it if your physician, you don't want to challenge your physician.
Thank you, Dr. Matthew. So, I think, what is important is that, as Dr. Robert was telling us, that, we are having a higher death rate. The mortality is not as less as it should be in a state of our size with the number of, cases that we have. Am I right, Dr. Robert? We specifically want you to stress on that point, what are the tests that are to be done, what are the signs that one should look out for, and when should we say go to the hospital? Because people sometimes, first of all, they don't get tested, they just stay at home and they get serious, and then then by the time they get to the hospital it's just too late. So we want you to tell us what stage is the right stage for you to go to the hospital.
Yeah,
Dr.
this
Robert,
is the important.
would you like to tell your experience? Your Please unmute mute yourself.
Yes, good evening, ma'am. Good evening, sir, and good evening to all the viewers. So, as we know that more than 2% of our population has already been affected, and with just 2% of our population being infected with COVID, we already have 522 deaths. So just imagine what would happen if more of our population would be infected by COVID. And this 2% of COVID cases being detected is only the tip of the iceberg. We have 20% more cases at the bottom of the iceberg which are being undetected. Now, as we know, an infected person, 75% of those infected don't develop symptoms. And we also know that fatality is higher among the comorbids and the elderly. Now, in our state, we have about 17% of total deaths till date, and these 17% deaths are all non-institutional deaths, means that the person died either at home and he had been tested COVID, and while testing he was found to be positive, or either this person reached the hospital late and while testing for COVID found to be COVID positive, but then he reached hospital late, which led to his death. So we still see that there is denial of having COVID symptoms among certain families and community. So to tackle this, we also have 80% of the active cases, active COVID cases, opting for home isolation. So to tackle this, we have in every district, under the leadership of our deputy commissioner, we have a decentralized model where we have the COVID war rooms in every block with a helpline number 24/7, where anyone can call these helpline numbers for any medical advice and service. So the services would be provided by doctors, paramedics, 24/7 with regards to either COVID symptoms or non-COVID symptoms. And also they can have services like if they require transfer, the ambulance services there, the mortuary vans are there. So my question to sir is that how would you advise on the course of management of home isolated patients to identify the early danger signs for prompt referral of these 80% home isolated cases?
Thank you, Dr. Robert, for flagging that very important question. How do we know? Now, until very recently, what was happening was everyone was told that you have to look at your oxygen saturation and then take a call. And if your oxygen saturation is dropping, then you have to think in terms of when the saturation is dropping below 94%, there is a red flag. Okay. And if it is below 92%, you have to be admitted in the hospital. So these are situations which are very clearly not realistic, especially in the periphery, especially in the villages who will have the digital sensor. They may not know how to read it, they may not know how to put it, so they will have problems. So there is you may decentralize it, it may take a little while, but eventually it may happen. But at the same time, one has to understand, I'll come to the mistake in this digital sensor method of deciding. So what is the better way of deciding? From what I have understood, I got this understanding based on these. These are notings from my diary, and I am on to my sixth diary now. Every patient I contacted, I kept track from day one of his first symptom till he recovered after full treatment or he was on a ventilator or whatever. I kept following up every one of them. And that understanding, when I looked up the literature and the papers and all the review that were done, gave me an understanding that this disease has a clear pattern. And the clear pattern is first symptom, about 5 days or so, they have very mild symptoms. Nothing happens. It is only by fourth or fifth day, they're actually saying, no, we are okay, nothing is wrong. Fourth, fifth day from the first symptom. So the first symptom documenting with a diary noting like this, day one is important. And keep noting down the temperature, morning and evening. Teach people how to take the temperature. Or you feel feverish, you put down. You may not measure it, you say feel feverish. That's it. But on the fourth day, third day, end of the evening, you will notice fever has suddenly come down. So throat is less, body ache is less, headache is less. They start feeling better. But on the 5th, 6th, sometimes on the 7th day, and the 7th day was in the earlier wave. In this Delta variant virus that we are seeing, it's a little earlier than 7 days. It's usually by 5th day morning, they again start having fever. Fever had come down, and then fever had come down, and then it has restarted again. It has restarted again. And therefore, you start worrying at that time. You start worrying at that time because fever which has come down is now coming back again. Fever which is low grade is now little moderate grade. So fever is the most important symptom which tells you the disease is going on to a more dangerous turn. The dangerous turn in the disease is indicated by fever which is coming back. The second thing which they have is a congestion in their chest. They'll say we have a congestion in our chest, or they will have a deep coughing that has come up. Cough that is there, which is different from these little sore throat, itchy throat that they have. It is a deep cough that comes up. They don't have breathlessness. It's only fever coming back, congestion, and a deep kind of but nothing comes out. No phlegm comes out. It's a dry cough. It's a deep cough. But they're not breathless at this stage. Their oxygen saturation, if you measure with this digital sensor, it will be normal. But you leave this untreated at this stage, you go on to the next stage. And by 7th day, they will notice, oh, saturation is suddenly dropping. Oh, it is 93. No, it's coming to 92. That is when you have a problem. So if you keep waiting for that, then first you have to understand why does this happen. It happens because it is not the virus. Earlier it was thought that it is a virus and the pneumonia from the virus is causing this problem. It is only when they did post-mortem studies in Italy, a pathologist found it is not a pneumonia. It is clotting of blood within your blood vessels of your lung. So in your lung, blood circulates and exchange of oxygen happens between the air and the blood. And the oxygen saturation in your blood goes up, okay, to 100%. But in this, what happens? The disease causes clotting of blood in the blood vessels. So exchange doesn't happen. But there are still areas of the lung with blood supply, and that compensates, and you still have 97, 98, 99% on the 5th day, on the 6th day from the first symptom. You continue to have normal saturation. Why is that so? Nature designed us with lungs with a lot of spare capacity. So if you have maybe a lung cancer or maybe you have extensive TB on one side of the lung, you can remove the whole lung. 50% of the lung can be removed with 100% saturation in room air. 50% is removed. Even with the other lung, you may remove part of it, maybe another 1/3 or even 2/3 may be removed. You will still be able to function with 96, 97% saturation. It doesn't go below 95% because of the built-in capacity of the human body to have spare capacity. So when you have clotting of blood within your blood vessels, this clot continues till the 3rd day of that dangerous phase, which is 7th, 8th, 9th day. When 2/3 of your lungs is gone, only then your saturation drops. Don't wait for that. Your turn takes a dangerous turn on the 5th day from the first symptom. 5th, 6th, 7th day, if you have fever coming back, cough coming back, congestion coming back, start your medicines. And what are the medicines? This pneumonia is not caused by the virus. It is caused by body's immune system attacking its own blood vessels. Normally, blood never clots in your blood vessels. In your veins, blood never clots. It never clots inside this. It's always flowing. It's always flowing. But in this disease, the lining of these blood vessels in the lung, not here, in the lung, sometimes it happens here also. We see it in children. I'll come to that later. So in the lung, the blood clots because the cells lining this is attacked by the body's antibodies that were created to fight the virus. And why is that so? Because the structural similarity between the virus surface protein and the protein on the lining cells of the blood vessels that get damaged because the antibodies think that is virus. Actually, it is not virus, it is the body's own cell. So it's the auto antibodies against the body which is causing the disease. It is not the virus. Attacking the virus doesn't help. Giving medicine for the virus doesn't help. It is the auto antibodies. You need to suppress this auto antibody by suppressing the immune response. And that is where two drugs come up. One is a steroid, and the other is a blood clot preventing drug, which is anticoagulant. So, two key drugs given when the disease is taking the dangerous turn, but do not wait for this. You can continue this at home also, but under medical supervision. So, your block level doctor who is there can guide the family with the clear understanding, with the precautions that are required for these patients. Watching out for diabetes, watching out for kidney disease, watching out for other medical problems, and then treat them at home. It is only when, despite this, your saturation is dropping, usually on the 9th day from the first symptom, you need admission. That is the time when you need admission. So by treating them at home, you can, at this stage, you can prevent them from getting onto a dangerous turn, getting on to need oxygen, getting on to need ventilators, and getting on to take a serious turn. So just this timing of the intervention can change the
Yeah.
course of the disease.
Thank you so much, Dr. Matthew. That is such an important message. I really hope that not only people but also doctors are listening. But we also have with us today Dr. Adreena Lyngdoh, who is the additional DHMO of East Khasi Hills District. She is looking after vaccination, so she moves around a lot and she meets a lot of people. And she has met some people who have some very special, problems. So I think she has some questions to ask you as to how to tackle those problems. Please, Dr. Adreena, please go ahead. Unmute yourself.
Thank you, Dr. Carreen, for the the introduction, and I really want to thank you also for the fact that you're hosting this talk show, which is very crucial at this time. And it's really a privilege also to be with a renowned Dr. Matthews Varghese. Sir, just to add up to what you had explained, I really feel it was important because for the doctors in the field, especially in the rural areas, we have come up also with these community coroner care centers, sir. And we have nurses also stationed there, whereby they do the monitoring of these positive cases who are asymptomatic or very mild symptoms. That means category A and B. The main aim is to prevent further spread among the family members, as well as to get the system of monitoring them so that early treatment, early intervention can be taken. So on that note, sir, thank you so much for that very simple, elaborative explanation regarding those days, like whereby these doctors who are also monitoring these centers as well as the home isolation cases will be able to have a clear idea and also gain clarity as to when intervention should be taken. Another point, sir, I would like to add here, because we also had 4 maternal deaths, which is related to COVID infection in the last 1 month. So I would like to, sir, that you would like to request you to kindly, maybe there may be a special kind of treatment, or maybe what line of action should be taken when a woman is pregnant and then affected with the COVID-19 infection.
Yeah, thank you so much. One more clarification before I move on to that, answering that question, is the fact that at home, for example, a normal human being, when he climbs 2 flights of stairs, he gets breathless, isn't it? When you check his saturation at that point, it will still be 100%, but you're breathless. So your breathlessness is an earlier symptom before this happens. So breathlessness can be informed to your local health authorities before you go to the hospital. I'm getting breathless, and they have this 6-step, 6-minute walking test that they do. If you're getting breathless, it's a clue that your lungs are getting more damaged than what they should be. Maybe you need to seek medical help. So breathlessness is a far more sensitive sign than anything else. When you're dealing with a pregnant woman, the outcome of pregnancy is far more vulnerable in presence of a corona disease. Therefore, there is a risk to the mother. You're dealing with two lives here. Risk to the mother, risk to the child. Both are at risk if you do not find the times correct. So in the mother, there is an additional problem. Because of the baby in the abdomen, the excursions of the respiration are not as good. So the mother tends to have more difficult time when she's breathing with the baby in her tummy. In addition, many times doctors advise people with difficulty in breathing to lie on their tummy. So these mothers have difficulty lying on their tummy. They can only lie on their side to improve their breathing capacity. So these are situations which are very challenging in these mothers, but we are dealing with two lives, and therefore we are very proactive in finding out a dangerous turn in these mothers. If the disease after the 5th day, fever is coming back, patient is having breathlessness, which is more, and having a deep kind of a cough and congestion, you will start treatment. And the treatment that is recommended, steroids and anticoagulants, both are safe in pregnancy. The risk of a pregnant woman not getting treatment, going into a poor outcome, is much higher than the risk of drug-related complications. So please remember, if the doctor can give the medicines, he should give the medicines under supervision. The obstetrician should give the medicines, anticoagulants, and in fact, they have tested these placenta and found that there were clots there also. So the tendency for clotting is there in the placenta also. So you may need to do an elective cesarean early on. You may need to do an early induction of labor, and also try to protect the mother from the serious effect, which is because of the baby being in the tummy and difficulty in respiration. The medicines are safe and they can be given in pregnancy.
Thank you, sir. That was very enlightening. And
I
again,
think
since
Dr. Adreena had one more question. You know, you had another question about the efficacy of
no, I think that was already addressed by in the earlier part of Professor Varghese, explanation. He had spoken about the role of ivermectin, because I just wanted to be clear about that. And most of the doctors also are asking me that question. So just that, I think Sir had already addressed that. And in view of the vaccination part, sir, we are doing well, not that well in vaccinating, which is uh, one of the measure of containing the spread, and also ensuring that morbidity and mortality rates are reduced. So I would like that you would also give a kind of a, kind of a motivative speech, especially for the public who are viewing this, in order to encourage them to go for vaccinations, sir, because
Okay.
the percentage in our district is just 21% for the 18 plus, sir.
Yeah. Thank you very much. I think Dr. Roberts also highlighted the number of persons that were infected, only small 2%. But
Yeah,
look at the mortality.
Yeah, 1 second, Dr. Matthews. I think I wanted to, before we move on to the vaccination part of it, I would like to, for you to stress a little bit on comorbidities, because people are worried that I have comorbidities. If I go to the hospital, I will die. There are a lot of things that people are worried about. They feel that they're not well enough to take a hospital's situation. So, what are the comorbidities that people should be concerned about, and why do you think that they should be addressed, and why should people who have comorbidities be a little bit more alert than other people?
Okay. Thank you, Karen. I'll come to the vaccination a little later. The people who have key problems of diabetes, coronary artery disease, hypertension, these are people who have been shown to have a higher death rate. Why was that so? When the disease takes a dangerous turn, in the 10 to 20% of cases, the dangerous turn initially leads to only clotting in the blood vessels, increased tendency for clotting in the blood vessels. So this tendency continues if it is untreated. But if it is treated, how do you treat it? By giving anticoagulants and by giving steroids. What do steroids do? If you're a diabetic patient, the blood sugar with steroids shoots up to 400, 500. That takes the control of sugar haywire. Number one. Number two, patients of blood pressure have salt imbalances. Steroids also affect your salt balance. Number three, patients with heart attacks, they have tendency for blockage of the blood vessels supplying the heart muscles. Now, in this condition, there is a tendency for clotting in the blood vessels. So this may extend even to the blood vessels supplying the heart muscles, and that usually happens after 3 weeks or so, not in the early part of the disease. So after 3 weeks of the first symptom, you tend to have these kind of clots in your blood vessels supplying your heart. So heart attacks happen after 3 weeks or so. So they have had the disease, you've started treatment in time or late, they continue to have the disease. Despite treatment, sometimes they have continued, but that's a smaller number. Most get controlled with timely steroids and timely anticoagulants. But after 4 or 5 days of steroids, your pneumonia takes a different turn. Pneumonia becomes a bacterial infective pneumonia. And that is where your comorbidities create problems. Your bacterial pneumonia outcome is worse in a patient of diabetes. Bacterial pneumonia outcome is worse in a patient with a kidney disease, is worse in a patient who is a renal transplant patient, worse in a patient with liver disease, worse in a patient with any immunity which is suppressed. Therefore, they get into florid pneumonia, you get all kinds of antibiotics, the pneumonia then needs ventilation, and then ventilation, you continue, then they have all the other systems failing one by one. And the end then is a very, very distressing end for everyone. So we need not go through that. If you have the comorbidities, tell your doctor upfront, correct them and control them well while you're giving these medicines. You don't have to worry at all. Even with the worst comorbidity, you can be taken out safely despite all those problems. It's only a small number that you have to worry, and despite your best efforts, you're not able to manage. Otherwise, you're able to manage. The clotting which happens in the blood supply to the muscles of the heart and also in arteries, that is seen in children. A direct involvement of the heart, it's a very rare. In fact, initially in the last wave, only 35 cases of myocarditis were reported, or 35 cases of Kawasaki disease were reported in that. That's a very small number considering the millions of cases that were infected. So don't worry about that. That's in a minority. Majority are people with comorbidities. Just need to be cautious in their management of their comorbidities and anticipating a bacterial infection when it happens. So fever, when you start steroids, fever will immediately come down. But 3-4 days down the line, fever again starts rising. And that's when you suspect it's bacterial infection. So that is the time, 8th, 9th, 10th day, when you may need to have blood tests done. You need to look at the blood count. You need to look at the test that doctors order for. You look at the serum ferritin, LDH, D-dimer, the ESR, CRP, CBC, all these things are ordered by the doctors. And that is you. You don't have to do it on the first day. You don't have to do it on the 5th day. You do it only on the 9th, 8th, 10th day, depending on the symptom of the patient. Don't waste your resources. You don't have to rush for a CT scan. You don't have to rush for a CT scan. You can manage. In fact, if your ultrasound, a point of care ultrasound can clearly identify a COVID pneumonia from a bacterial pneumonia. Clearly, you can just train yourself. In fact, there is a good training program conducted by Dr. Bhoi and Dr. Tej Prasad Sinha in All India Institute of Medical Sciences. You can, if you contact me, I'll put you in touch with them. They will train you how to do point of care ultrasound. Don't worry about CT scan. That's a very good tool that can be used at a peripheral center. You can manage with that.
That is wonderful, Dr. Matthew, because this was going to be my next question to you. That, when, at which point should we order the blood test? Now you've answered that question already. You've answered the question about CT. I think there's just one point that, I want to touch, because a lot of times, people are at home, they're breathless, and we tell them proning kar do, do proning. So we teach them proning, we teach them a little bit of the physio. Now, in your experience with home care for patients, how much have you seen that this helps? Does it help, and how much does it help?
Honestly, if you need to be prone for improving your saturation, you're a candidate who needs to be in a hospital. So I am
Okay.
not comfortable keeping these patients in home care. I am not. When they go back home after recovery from corona disease, then they can be prone as an exercise to improve your comfort zone, but not in the pre-hospitalization stage, but in the post-COVID stage when they have recovered and they're going back home. You teach them proning, and you do that in the hospital setting. Yes, doctors will prone you to improve your saturation, because some patients, you see, because the lungs, the back of the lungs is what is clearly involved. Proning improves the aeration of the rest of the lung. Therefore, proning is a very useful measure, especially in patients that are on ventilators or high flow oxygen. Their proning helps very well. So, in the hospital setting, in the post-COVID setting, post-hospital setting, but not in the pre-hospital, I would not recommend it. No.
Okay. So if I would just put that together, I mean, for the people who are listening, the points that we have to stress is, so you can be okay in home care, watch your temperature, watch your BP, watch your saturation, and after day 5 or 6, in case your fever comes back, get a blood test, get the other tests done. And if you feel at all that you are needing something extra, some extra effort to breathe, reach out to a doctor or to a hospital or to some place where you may be able to get further tests, further investigation, and probably started on steroids if required. Yeah.
Thank you.
So another thing that I wanted to ask you, Dr. Matthew, is because we are hearing a lot about people who are who are post COVID and who just drop dead. So what is the post COVID care that you advise for people? See, our intention is that we are not taking people only through the COVID time. We have to keep them safe. So, this information I feel is very important, because we have cured them of COVID, but we have not explained to them what are the post COVID problems that they may have, and what are the parameters. There's nobody really knows, like, what test should I get done, what levels are okay. So if you could just elaborate on that a little
Yeah.
bit, please.
There are multiple aspects of this post-COVID care. One relates to tiredness and body aches and difficulty in moving around. The other relates to breathlessness because of the severity of lung involvement. That needs regular exercises using what is known as an inspirational spirometer. But what do I tell my patients? I tell them just go and buy a packet of balloons and inflate 2 balloons every 2 hours. Very simple exercise for the lung. Just inflate balloons. You don't need to buy that 1500, 2000 rupee inspirational triflow You just spirometer. You just can manage with just balloons and inflate every 2 hours these balloons. They'll keep your lungs exercised well enough and keep your alveoli, the air spaces in your lung, open, and air exchange can happen nicely. So that is your exercises for your lung. Don't do vigorous exercises like jogging, treadmill. No, we do not recommend that, because the tendency for clotting remains for 3 to 4 weeks. And the cardiac problem that you're talking about happens in the 4th week or so. So that is why you give steroids only for a week, not more, at best 10 days. Anticoagulants are given for 3 to 4 weeks. 3 to 4 weeks. Why? Because your tendency for clotting stays for 3 to 4 weeks. And in that period, please do not do any vigorous exercises, because if there is a tendency for clotting and you happen to have a clot in your coronaries, you will drop dead, or You may have myocarditis, which comes up in the 4th week or so, or children, they are finding this. So how do you identify them? They will have their heart rate fluctuating. They'll say, I'm having palpitations, but I can feel my heartbeat in my chest. And that can also be anxiety. Many of them are very anxious. So you may need to give get into a counselor, psychological counseling, a doctor who can give them a mild anxiolytic, or, counseling sessions will help. But what is important is that these patients may be having a true problem in their heart, and that will be increased heart rate or decreased heart rate coming down to 40, 46. These are patients coming in the 4th week who need 2 additional tests, which are cardiac related. A cardiologist or a physician will guide you, which is known as BNP and troponin. These two, echo may be advised by some doctors, but usually echo doesn't pick up these things. So these 2 tests may give you a clue, but you may not pick it up all the time. So these are the patients who we need to extend anticoagulants under the guidance of the physician for a little longer and nothing more. But no vigorous exercise in between 4 to 6 weeks. It's only gentle, gradually getting back to action. That's what is recommended.
Thank you so much, Dr. Matthew. I think we've touched all the things about the disease, but now if we go back to Dr. Adreena's question about the vaccines, please. I'm sorry to have interrupted you, Dr. Adreena. I just wanted to
Thank you for the time. The vaccination. So, as Dr. Robert mentioned, only 2% of the population have been affected in Meghalaya, and yet you have 500 plus deaths. Imagine if the 98% were to be affected, you will have a catastrophe, which is what we saw in Delhi. My God, I wept through the nights, several days, 3 weeks on a row, night after night. It was really a harrowing time. I hope and pray you don't go through that at all in your state. And if you take these precautions, you will be able to avoid many of those problems. So one way is, if you don't have a vaccine, you expect that you have 60 to 70% of people getting infected. Then you have what is known as herd immunity. Most people that are vulnerable to the disease have got the disease, and they will not infect anymore, and that is the end of the disease in the community. But that will mean a large number of people to get infected, and a large number of people may lose their dear ones. We don't want that. Therefore, the importance of vaccination. So you need to vaccinate, and the vaccination is the kind that are available in India for the moment. We have 2 key vaccines. The third one is being imported. The 2 vaccines are, one is Covishield, which is the Oxford vaccine. The other is Covaxin, which is the Bharat Biotech vaccine. It is our own indigenous vaccine. Covaxin is a killed virus vaccine. It has been killed and has properties to stimulate antibodies, which will fight a virus if a living virus if it enters our body. That is one part. The other one, and this vaccine was released late, so the trials were completed only in the first week of March. Therefore, all the international approvals haven't happened. They have applied for it. It's still in the pipeline. Covishield, however, was an Oxford vaccine which had trials. All the phase 3 trials were there. And what we'll do in phase 1 trial, phase 2 trial, phase 3 trial, phase 3 trial looks at the efficacy. Phase 1 and 2 looks at the safety of the vaccine. So these vaccines have been found to be reasonably safe. Any vaccine that is designed has to be safer than any drug that you give. Remember, a medicine is given to an ill patient. A vaccine is given to a normal patient. So your safety profile, when a vaccine is being investigated and researched, has to be way above that of a drug. So a drug may have all kinds of other complications. You can accept that, which is given to an ill patient. But a vaccine is given to a normal human being. So the safety profile has to be very high. So when you look at the safety, you have to make sure that it is only 1 in 100,000 to 1 in a million patients that you have a complication. So though the media highlights all the complications, rightly so, you have to be aware of it. But compared to the risk of getting the virus infection and death from that virus and the morbidities that go with that virus, it is far safer to have the vaccination. So that is the importance of the vaccine. So you have the chance when your population only 2% has been infected. Rest, we don't want them to be infected. We need them to be vaccinated. So accept the vaccine, and remember, once you have taken one jab, it is not sufficient. It doesn't give you good protection. It gives you somewhere between 35 to 55% protection. It doesn't give you full protection. You need to have the second dose. And the interval of the second dose, there was again some controversy in that initially. That is because the initial reports were 4 weeks. That is what the manufacturers they designed it to be. But by sheer chance, they noticed that when you extend the gap between the two doses, the antibodies are far better, and you're able to fight the virus better. So it is by chance. So therefore, the interval was extended. So the current recommended interval by the government is 8 to 12 weeks. So you have one dose, you have the second dose in 8 to 12 weeks. Now, what happens in this 8 to 12 weeks? Are you resistant to infection? No. Therefore, your mask is paramount. Even if you are vaccinated, you need to have your mask. Even if you're vaccinated, you need to have your sanitizer, and make sure that you do not forego these two key protective. And believe it or not, I'm not exaggerating. I've had children with COVID positive screaming into my face, and all I had was this mask, nothing else. I had my bare hands, I was not even wearing gloves. Just my mask protected me. I don't touch this surface of my mask as long as I'm in the hospital. And if it comes off, I immediately wash my hand and I do not touch that. That is the only protection. I have not missed a single day in the last 1.5 years. Not a single day have I missed going to the hospital. And in the peak time, we were seeing 4 or 5 corona patients, because I'm not a physician of that kind where I work in the COVID ward. My understanding has come as an outsider. I was able to analyze the disease and the patterns and the perspectives of the evolution of the disease far better as an outsider. Therefore, this understanding has come, and by and large, we found we have been able to save a large number of people from needing oxygen, and needing the need to go for ventilators. So this is what we have found. So it is very, very useful to look at the time of first symptom, 5th day, fresh fever, fresh congestion, fresh deep cough, dangerous turn. Consult your doctor in consultation. Don't do it without consulting your doctor. Start the medicines, and you may continue to stay at home. Breathlessness is more sensitive, but with only 2% population in Meghalaya involved, I would recommend vaccination to as many as possible. As of today, the safety profile of the vaccine is proven for Covishield for all those above 40. All those above 40. 18 to 40, they have found that the small number of higher incidence of clotting than the general population. Does it mean you can't have it? Yes, you can still have it, but the probability of the complication is slightly more than in the 40 plus population. So that is there. But the vaccine has not been proven to be tested in children. Therefore, we are waiting for the tests. They are being done. Tests are underway. Until the results are out, we do not recommend that children be vaccinated. But can we give it for pregnant mothers? Yes. Have they died testing in pregnant mothers? They have found that some patients who got the vaccine, they got pregnant by sheer chance. By an accident, they got pregnant. And they followed up these pregnancies and they had normal outcome. So they found that it's reasonably safe, and that is what was found in the Pfizer and the Moderna vaccines. By sheer chance, they found many of them. Now they're having testing done in pregnant mothers also. But the current recommendation is 10 weeks, 12 weeks after the first 3 months of pregnancy onwards. After that, you can give the vaccination safely, including mothers that are breastfeeding. You can safely give the vaccine in those mothers also. So that's the recommendation that we have now. You can give them, because the outcome of the infection in a pregnant mother is far worse than having the risk from the vaccine. So we would recommend that pregnant mothers also get vaccinated. From the second trimester onwards, you can get them vaccinated and protect them.
Okay, I'm sure a lot of people would have become, braver after listening to you, Dr. Matthew. But somebody there is a person who has just sent a question online. Okay, so this is one Hey Q Sutna, and she is saying that she says, "Good evening, sir. This is a very informative session. But my question is, we know that active COVID cases, can't get the COVID vaccine, but then around 75 to 80% of COVID positive cases are asymptomatic. How do we know that a person coming to the vaccination site are not positive? And how do we screen each other before we come to the vaccination center?" So people are basically scared to come to the vaccination center for vaccination because they feel that they may get infected.
So have people in the trial phase got the disease while they were injected? Yes, some of them have been infected. Does it cause a problem? They haven't found any serious issues while they got the disease after the vaccination. Many people that I know had the disease. Incubation period was there. That is the time when they don't show the symptom, but they have the virus in their body multiplying. That is called the incubation period. So they've had the virus in them, they got the vaccination. Did they fare worse? No. So there is no problem from that perspective. So you do not have to do any test. You do not have to do any screening. You do not have to do any blood test. CRP, there was a huge hue and cry. Test CRP, test your antibody levels before you go for your jab. No, there is no such need for that. All that you need to is, if you think you've had a cold and you think that you could have had COVID, wait for 2 to 3 weeks, definitely. But if you're definitely tested positive, the current regulation of the government is wait for 3 months. So if you confirm to be COVID positive, wait for 3 months before your injection for vaccination. Has it caused any additional problem? No additional problem has been found in those who have had the disease and who have been given the vaccine. Why do you wait for 2 to 3 weeks if you think you are COVID, but you're not sure and you've not tested also? The reason is, in the early phase, the disease, the virus is eliminated in the body by around 8 or 9 days, not 3 weeks. It's by 8 or 9 days, the virus is killed. All of it is killed from your body by your own antibodies. So there are two types of antibodies that deal with the virus. One, in the acute phase when it comes up right in the beginning. The second, when it comes up after a gap of 3 or 4 weeks. So there are different type of antibodies, acute phase antibodies and a chronic phase antibodies. So acute phase, within the first 5-6 days, the antibodies come, fight the virus, eliminate the virus. So if you're within that 2 to 3 week period where the acute phase antibody is there, what do you give in a vaccination? You give either a killed virus or a weakened virus particle, okay, or a part of the virus particle. What does it do? It stimulates the antibodies. So if you have antibodies already circulating, it will kill these dead virus, it will kill these proteins, and there will be no immunity developed. So your immune system will not improve in its ability to fight a genuine virus when it attacks you. Your vaccine would be given, but you wouldn't have the immunity that is sufficient. Therefore, wait for, so the scientific basis is wait for 2 or 3 weeks before you do that. Otherwise, the regulatory basis is, if you think you've had COVID and you definitely had COVID, wait for 3 months.
So I have another viewer with a question which says that will the different variants have different symptoms? I think you had already, no, we didn't touch on that. Actually, that's a good question because, I find that what happened was that in the last variant in 2020, we had people who had, we had a full lockdown, right? It was a nationwide lockdown, but very few people got ill. So everybody in Meghalaya thought, oh, this is just not really a disease. So it's important for us to tell people that, yeah, this is a disease which is, different from the last disease.
Yeah, in terms of symptoms, there are clear differences between the previous wave, and I know it from my diary notings because I kept noting the symptoms and the timelines. Earlier disease, we had fever, sore throat, and cough, some headache, very few loose motions. And when were loose motions noticed? Loose motions were noticed around the 7th day. When was the dangerous turn noticed? Around the 7th day, a little later. In this surge, we found the virus is much more contagious. Not just one person in a family, but entire family, including the housemaid and the driver. Everyone has become positive. Very contagious. Number one. Number two, the symptoms are far more rapid than the other one. And in the older one, loose motions were coming up later. Loss of sense of smell and loss of taste, anosmia and ageusia were happening around the 7th to 9th day. In this, we are finding it from the 3rd day onwards to the 6th day, you're finding anosmia and ageusia. So the symptoms have been fast forwarded in this particular case. And the post-COVID cardiac problems also we are seeing a little more in this variant than the other one. A persistent loose motions has been seen in a larger number of patients than in the previous case. So there are subtle differences in the presentations of the two viruses, and the Delta strain has been a little more aggressive in terms of faster onset of symptoms and a wider variety of symptoms. And in children, larger number of children were affected than in the older wave. In this wave, we had much more children coming to us, getting even a 1-year-old child was admitted in our pediatric ICU with COVID positive. 1-year-old. So we are seeing a larger number of pregnant mothers, a larger number of children being affected, and some of them have been showing what is known as a Kawasaki disease, whereas it's an arthritis of the blood vessels getting damaged, causing gangrene and loss of fingers and digits and toes. That happens after 4 weeks. Many times the child has had a little fever, no testing has been done. You look at the test at that time, you find it, oh, maybe this was COVID. So you have to have a high index of suspicion here also. So the symptoms have been different in this.
So we seem to be having a lot of viewers, and another viewer called Prithvi Sharma is asking you that why is it that sometimes the RT-PCR shows a negative test whereas the CT scan shows the virus in the lungs?
Yeah. Let me clarify. CT is not showing the virus in the lung. Virus does not cause anything in the lung. What is seen in the lung that is what they say. It is not a pneumonia lung. Pneumonia lung happens after 4 to 5 days of a COVID lung. COVID coronavirus lung is because of blockage of blood vessels. In pneumonia, what is happening is the air spaces, the infection by the bacteria, fluid leaks out into the air spaces, and the air spaces are blocked. And it is what we call a whiteout of that portion of the lung. In this, it is not a whiteout. It is a graying which is shaded. We call it ground glass opacities, like the bathroom glass that you see, which is, you can't see through that glass. So it's a ground glass opacity. GGO is what your CT scan report will say. GGO seen, score less than 10 is mild, 10 to 20 is moderate, 10 to 19 is moderate, 19 to 25 is severe. Those are GGOs, that is not pneumonia. Please remember that is very, you have to have that very clear. So you need to understand that this virus doesn't cause the pneumonia. It is only caused, the pneumonia happens after 4 or 5 days of this blood vessel blockage. So that is what you have to have clarity on that. But before that, sorry, what was the other question?
No, about the RT-PCR only. Why does the
RT-PCR again? The RT-PCR is checking for the RNA in that sample that is done. So in this particular strain, the kit that is used misses out 1/3 of the cases. 1/3 of the cases. But the virus may still be there, and the virus will provoke an antibody reaction, the auto-antibody reaction, which will cause the COVID lung, and the CT scan will show it. So CT scan becomes more sensitive there than your RT-PCR. So false negative is high in this Delta strain, but in the other strain, false negatives are much lower.
As we had already discussed, I think you discussed that extensively before. Yeah. So I think we've taken too much of your time, Dr. Matthew. We were supposed to go on for much less time, but I'm so grateful. And I think maybe, we should let you go. I'm sure you have other things that you need to do. And I thank you for your commitment and your participation. And I'm sure that with this, session, we have at least saved a lot of lives, and you have clarified a lot of, things to people. And I do hope that, this message goes to more and more people so that we are able to make a difference. That's our whole point. It alarms me to see that, the mortality rate is so high. And that is the reason why I just want to clear out all these doubts to all of these people so that, they come forward, they get treated. There is no stigma in this disease. It's a virus like any other virus, so you just need to come forward and get treated. That is the important thing, and the treatment has to be done at the right time. Me ban lit test that he long positive, he even shimmy treatment, ka vaccine kan pinbha naman tajong ki kan ibor ya ka metong ki bakan yalay ya kani ka virus namarba ladak him doni ki tu ki antibodies kala ban penlep ya te knang ba pinum sha penlep kani ka virus he even let shimmy ka tu ka vaccine knang ba pindup doni ka tu ka jingla ban fight ekatuka vaccine na po jungki the jing don jung to antibodies shimbaro artli ki antibodies na marla ki shimbaro art kan klanye phi na po. Thank you so much, everybody. Now I just want to stress on the things that you said, Dr. Matthew. First of all, we are on lockdown. Stay at home, stay safe. That's the best thing to do. If you do have to go out, please wear a good quality mask, because just wearing a mask, which is a cloth mask, is not going to work anymore this time, right, Dr. Matthew? I don't think cloth masks are working very well. So,
but any mask is better than no mask.
Yeah, but it is.
Remember that.
It's important for you to wear
your nose and mouth covered. Maybe you can have a double layer.
That's right. And stay safe, be responsible, be a pillar to your community, save your people, and you can save lives. Not us, you can save lives, because you are the person who is responsible for yourself and for preventing the people around you from getting sick and for controlling this disease. Thank you so much, everybody. Thank you, Dr. Robert. Thank you, Dr. Adreena. And thank you so much, Dr. Matthew. I mean, we have really taken so much of your time. I'm sure you have so many more fans now. And I didn't tell everybody that you love Shillong and you've been there already 4 or 5 times. And I'm sure now you have so many fans that you'll have people who will be more than willing to host you whenever you go there. Thank you so much.
I've done house-to-house surveys in Maulai province, Lai Mukre,
so,
and
Smiths
Village.
You're famous.
Thank you.
Thank you so much. And thank you, Prakash, right, for handling this. All the people behind the scenes for having, done this. And I think it's been done very well. Thanks a lot. Thank you.
Thank you.
Okay. Good night, everybody. Good night.
The shadow came on us, took over our lives. But somehow now's the time we must unite.
Be bold, be brave, be still. In the end we shall heal. 'Cause there's an answer, and together we will stand and fight. Lagi lojing dong ka klam kitap kani. Ya kasharak jinker man min preman kasi.
Ki jing ya le, but ki จริงเฮถ้าจริงดูอันยินสับปอยชากะทองกะบางีเบ We will gather at the darkest hour in this battle with faith and power. Long as we don't lose track of sight, together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long.
Katung ai bu chim che the gen sal sao on chim nam the gen ta kru kan ku ai
no dingi perse kushna na hogi koi pabandi milke rehna hai humko jaise ho koi family.
Okay, be bold and be brave and be strong and fight on, live on. It's not the end, it's a bend in the road. Let's move ahead, no stopping yet. Let's move ahead, let's not forget. Faith alone dries every tear, and when all hope seems lost, let's bow down in prayer. No matter who you believe in, there's no denying a blessing. Heal and recover, let's stand here united as one.
We will gather at the darkest hour in this battle with faith and power. Long as we don't lose track of sight, together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long.
Issued in public interest by National Health Mission Government of Meghalaya.